Have you ever wondered what it would be like to receive a kidney or pancreas transplant and be living with type 1 diabetes? Well, you're going to find out today on the Taking Control of Your Diabetes podcast. I'm Dr. Steve Edelman, and I am not here with my good friend and colleague, Jeremy Pettis. And so we have a special guest today. Her name is Kristen Hohmann. I met her 2 years ago when she came to our TCOYD face-to-face conference called One, and she developed type 1 diabetes at the age of 9. And at that time, she was the only person in her family with type 1 diabetes. And through the years, we can talk about her care later, she did develop the classic complications of diabetes, including kidney failure. And she came up to me at the conference and said, Dr. Edelman, would you be my doctor? I just recently learned I need a kidney transplant. So I'm going to let her tell the story because she can do a much better job than I. Kristen, welcome.
Sure. Thank you for having me.
Start off by telling us a little bit of your story, as I tried to do in the beginning, and how you were told all of a sudden, out of the blue, you needed a transplant or had to go on dialysis.
Yes, absolutely. So as you mentioned, I was diagnosed when I was a kid. I've now been living as a type 1 diabetic for 35 years. I have had a lot of the classic complications and have had a diagnosis of chronic kidney disease that has progressed over years. That didn't start probably until I was in my 30s. And I was mostly managed by an endocrinologist and a primary care physician who always just said, we'll just keep an eye on your labs. We need to make sure your kidneys are doing well. And then probably closer to my 40s, I was referred to a nephrologist at that time. I didn't understand what that meant at the time. I wasn't very well versed or educated on chronic kidney disease, the progression of it. And I just sort of assumed that would be something that would be treated or managed with medication, simple as that. I did start to see this nephrologist, and by the time I was actually in the care of a nephrologist, I was already almost in stage 4 kidney disease. I probably only had 2 appointments with that nephrologist before the appointment where I went in, where I had assumed it was just a routine check-in. The only medication I had ever been prescribed by this nephrologist was sodium bicarbonate, which not really affecting the progression of the disease at all. And in this appointment, he looked at my labs and he said, has anyone talked to you about your options? And I was kind of like, options for what? Mm-hmm. And he basically said dialysis or transplant, and you're young, and I'm going to refer you to our transplant center. And that was a punch in the gut. I don't even remember walking out of that appointment. I was so shocked and stunned and upset, and I probably sat in my car in the parking lot for a good hour crying after it because, I was feeling better and probably healthier than I had most of my life. I've always been super active, and I felt like I was young, and this couldn't be happening to me.
Yeah, well, gosh, thank you for that. That makes me feel like I got punched in the gut, because having type 1 myself for so long, and I do have chronic kidney disease stage 3, I always say to myself, I do not want to be on dialysis or a transplantation unless I have to. Yeah. There's a lot of what we call in medicine pillars to prevent the progression of diabetic kidney disease. And we now have like 4 or 5 pillars. Many of those were available at the time, when you started to develop kidney disease. And we do have a lot of programs on that on our website, not only for people living with diabetes, but also healthcare professionals. And I encourage everyone listening to go look those up on our website. And we also have short form on all of our social media channels. But looking back over time, it's got to be so frustrating for you that you could have had an impact. But putting that behind you, since I've known you the last 2 years, you do see a retinologist for your retinopathy, and that usually runs together with kidney disease, and hopefully that's stable. And at that point, when you finally realize that you're going to need dialysis or transplantation, I know you were like a dog after a bone. You wanted a transplantation. So tell us about how that process went, and please tell us how you decided to get a pancreas as well as a kidney, because most people, as you know, just get the kidney transplant.
Yeah, absolutely. So the first thing I did after was to start researching nephrologists, and I got rid of that one and got a second opinion, hoping it would be different. And of course it wasn't. It was the same. I had also started researching at that time if there were medications that slowed that progression or anything, just thinking I wanted to not have to do surgery or dialysis for as long as I possibly could.
And Kristen, I can interrupt there and say, yeah, I sent you to Dr. Carl,
yes,
the nephrologist I see, and your eGFR was so low, she was hesitant of giving you one of the SGLT2 drugs, Jardiance or Farxiga. But you know what? Anybody in your situation would say, what can I do to delay this? And you did try very hardly, and you did everything you could.
I absolutely did. Dr. Carl, I think, was either the third or fourth nephrologist that I saw, because I learned about the SGLT2s and their benefits, and I asked for them. And I was told they weren't comfortable prescribing since they weren't indicated for type 1s. And, if I was able to get it, they'd love to see how I do. So that's
not even funny. But,
no,
but it's true.
They can laugh about it now, but it's just, it was very frustrating at the time. And then fortunately, was able to see Dr. Carl, and, it took a period of time to accept that this is what I needed to do. And this surgery, this transplant was going to happen whether I wanted to do it or not. And then my goal was really to learn absolutely as much as I could about everything.
Including all the different transplant centers.
Exactly.
You did your research.
I did a lot of research. I really educated myself on the disease state, treatments, different transplant centers, surgeons. And that's when I really learned that a simultaneous kidney and pancreas transplant was an option. There are several ways that someone in kidney failure might opt for a transplant. Some people do the kidney only, but then they have, the transplant and then still type 1 diabetes to manage for the rest of their lives. And they typically don't do a pancreas in somebody who doesn't also need a kidney, just because it's a big risky surgery and the risks kind of are prohibitive for that reason. So, but I learned about it at the time, and I was pretty close to being in kidney failure. And as soon as I learned about that option, I said that's what I'm doing. Like, there's no other option to me, even though it's a more complex and perhaps riskier surgery. There just wasn't another option for me.
So a lot of people actually go on dialysis first before surgery, but you never needed to do that.
Right.
Because you made your decision. And, you always impressed me that you did not want to deal with this damn diabetes anymore. And you have to take immunosuppressants anyway. So why not go with the kidney pancreas? But you're right. I mean, you sound like a doctor now. Transplanting a pancreas is more complicated than a kidney, a lot more complicated. You got to find a donor, and there's all kinds of, we're going to talk about your complication, but it is a more risky surgery. There's more things that go wrong. And a lot of people end up getting a pancreas transplant, but then that fails over time, but luckily they're still left with the kidney. So what place did you pick, and how long did it take to get in the door? Because you have to wait for a recipient, both kidney or pancreas.
And there's a wait at most transplant centers too to just get in to be evaluated by them. There are just millions of people in the U.S. waiting to even get into these centers and have a transplant. I did a good amount of research. I looked at transplant centers in Boston, Chicago, Houston, California, obviously where I live, and also Arizona. And there is data online, the outcomes from all of these transplant centers. And in my opinion, for what I was trying to do, the Mayo Clinic in Phoenix, Arizona was the place I wanted to go for multiple reasons. Obviously, world-class medical care was a big one. They had very good outcome statistics. And also, the average wait time for just a kidney transplant alone in the state of California is about 10 years long. A lot of people die on the waiting list waiting for a kidney. And I was really hoping to be able to get a transplant before I ever had to do dialysis. That just felt so limiting to my lifestyle. So I was really focused on Mayo. I had my referral sent in there. It probably took 2, almost 3 months for me to get in there, get an appointment before they even process the referral. And I called back every week of that time period just to check in and, make sure they'd received it and see, how they were going through.
Squeaky wheel gets oiled.
Absolutely.
So is the wait line shorter for people that want both? That's what I'm just realizing now.
It's shorter at this particular center for 2 reasons. One, they pull from different regions of the United States. So California may be its own region. It's so large. Arizona is part of a different region, even though it's very close to California. And the average wait for a kidney alone is 2 to 3 years. So significantly shorter. The wait for a simultaneous kidney and pancreas is even shorter. It moves you up a little higher on the list because you're basically taking 2 organs from the same donor versus, they piece them up and a organ goes in different places.
Well, tell us about your journey. How long did it take?
Yeah, for me, I did my evaluation around March of 2024. It probably takes a good 6 months or so to get your evaluation done. Every medical test you can imagine gets run on you, everything from stress tests, EKGs, ultrasounds, psych evaluations, meeting with social workers. They just want to make sure that the people are going to do well in surgery and are going to take care of those organs. So there's a lot that goes into it. So probably about 6 months for the evaluation. And then once I was officially listed, which I believe was in April of 2024, I got my first call for a match at the end of May, which was crazily fast. And I happened to be out of town at the time. I had gone back to the East Coast, where I'm originally from, to see my family, knowing that I wasn't going to travel anywhere because I was basically on call from that point out. They could call me at any time and say, you need to get here. So the second call I received was in August of 2024, which was just a few months later. And that's when I went and had the surgery.
Yeah. Now, for the listeners and viewers, a pancreas, is tough to transplant, and you don't have much time between the passing away of the donor and putting it into a recipient, because it auto necroses. It's got kind of digestive enzymes, so that the time is of the essence, which is why you have to be really close. And they have all these special transport systems. So you went in August, and how are you doing mentally thinking about this? You missed the first call. That probably was frustrating, but it may have been too close.
It was very stressful. It was very close. I didn't feel totally ready at that time. Like, this was my time to just get my affairs in order and prepare and pack a go bag. And I wasn't ready then. By the time it came to August, I was kind of like, all right, we're doing this. So, and I will say I have fortunately been able to see a mental health professional. She's a health psychologist. She specializes in type 1 diabetes, and she's with the Behavioral Diabetes Institute, and was extremely helpful and instrumental in helping me prepare for this major, major life change.
Yes, Susan Guzman,
yes.
Of course, and her colleague Bill Polonsky, who has done many programs with us here on the emotional issues of diabetes. So that's smart that you went. Did you did you do things like make sure your will was in order?
Yes.
And things like that?
Yes, I did my will, my medical power of attorney, which was my aunt, because I knew my parents would keep me alive no matter what. Financial power of attorney. I tend to be a planner just naturally, so I actually made a giant spreadsheet with multiple tabs, care for my dogs,
wow.
Things I had packed, my insurance information, financial things. And then I got all of my kind of support team, mostly my family and a few good friends, and got them on a Zoom call and basically told everyone what their role was. And here's the schedule of timing, when I get the call, you do that. So it all goes seamlessly. And it was great to have that.
That is amazing. I'd love to see that someday. And reality, not all of us, we don't know when we're going to get hit by a bus.
Yeah.
And to have those things planned, even if you're healthy, is probably a good idea.
Yeah.
So, okay, you had surgery. How did that go?
Well, not exactly as planned, I guess. My first surgery, I had the simultaneous kidney and pancreas transplant. The surgery went well. I came out of it successfully. Both were working at the time. I went from recovery to a room in the ICU. And not long after, I probably had... I should mention, too, I also still had my Dexcom on at the time. I just didn't, as a lifelong diabetic, I didn't want to take it off. I want to know what it is. I wanted to be in control of it. And I was in the ICU, and probably 10 to 12 hours after my first surgery, I started to really not feel well. And I looked at my phone, and my blood sugar was skyrocketing. It was getting to the 300s. And I was just kind of like, something's wrong. If it's that high and, I'm feeling this way, something's going on. So that was kind of like, I flagged down the nurses and the doctor and, just kind of told them. And then they were taking my blood pressure. I also had like a hypertensive crisis.
Mm-hmm.
So my blood pressure was super high, and it was a scary time. And they basically said, we have to take you into emergency surgery. And this is the following day after my transplant.
Within 10 hours?
Yeah.
Oh my gosh.
Pretty much. And my mom and my aunt had been there with me, and they'd stepped out for just a moment to get some food and got the call that they needed to come back because I was going into emergency surgery. So in that emergency surgery, they discovered that my pancreas had thrombosed. So basically a blood clot had gone to the pancreas, and it died, and it needed to be removed. So my newly working insulin-producing pancreas had to be taken out the day after I got it.
Wow. And plus, I've seen your stomach mostly healed, in clinic. You're not my patient anymore because you don't have diabetes. Boo-hoo for me. I can see you here at the studio. How soon after did they find the second donor?
Yeah, it was, it was a miracle, honestly. But in that time, when I was in recovery from the second surgery, they said, well, typically you need to stay wherever your transplant center is for 6 to 8 weeks after the surgery. Just make sure everything's working, heal, recover. So they said, well, you're going to be here for 6 to 8 weeks anyway. We'll put you back on the list, and hopefully a match will come up in that period of time. And do you want that? And I said, yeah, I do, but I was really depressed after that happened because I did this extra complex, involved surgery for the pancreas. Not to say a kidney transplant is necessarily simple and uncomplicated, but it's much more so than a double organ transplant, especially with a finicky organ like the pancreas. So I said I would, and then they, had me back in my room. And one of the surgeons came to me the next morning and said, we have a match. Do you want it? And I said, that's what I came here for. Absolutely.
What a roller coaster of emotions. You get up for the first transplant, and then you get let down after going through pretty intensive surgery, and then depressed about that. And then the next day they have a, I don't know, that's amazing. The emotions up and down.
I mean, it was incredible because it was just, I'm a big fan of strike when the iron's hot too, right? Like we're already in this process. We're already, I'm going to need healing and recovery. And while it's fresh, let's just do the whole thing, because it would have been an option to wait and maybe revisit a pancreas later. But I was like, no, I mean, we have a match. Like, let's go. So I had 3 8 to 10 hour surgeries, 3 days in a row.
Oh my gosh. So that, obviously you're here, you're doing great. And how long were you in the hospital, and whose organs did you get? Do you know? It was like a gangbanger, right? I want to make the story interesting.
I know, that would be interesting. I would love to know, but I was in the ICU for about a week, I would say, and then I was stable enough to move to just a regular room, and I was there inpatient for probably, I think it was 13 or 14 days, and people have different experiences, obviously, with their journeys, but I struggled with low blood pressure and some other things. They cut you open and mess with all your insides. And so it takes a while after that happens for everything to kind of calm down, figure it out, start working with with these new organs. So they're very protective of donors and also recipients. So they don't share very much. What I was able to learn, my first donor, they said the person had a brain death, was being kept alive on life support, and that they were able to give me a little more time to get there, and the person's family still wanted to see them before they collected the organs. So they were, to an extent, sort of able to schedule that first surgery. The second pancreas, I didn't really learn anything about. The only thing I learned characteristic-wise about both of them was that the donor was 20 years younger than I was. So that was it's a heavy moment, because that means it's somebody very young who had their whole life ahead of them. But I'm so unbelievably grateful to those people and their families.
You know what? That's so true. Well, tell us how life has been. Bring us up to the current point in time. You look great.
Thanks.
I know you don't have diabetes anymore, and you have very nicely donated all your diabetes supplies. I've given to needy patients. Yeah. So how has life been? Not having to deal with your diabetes and having your kidneys function better.
Yeah.
Because I'm sure that as your kidneys go downhill, you don't feel as good as you would, but you don't really recognize it because it's a slow decline.
Yes, for sure. I mean, I feel amazing now that it took a long time to recover. It was a couple of months, and it's difficult, but you get through it. And life on the other side, I mean, there were plenty of times during recovery where I thought to myself, I regret doing this. This is too hard. I wish I could go back. And I have done a total 180 since. As soon as I started feeling better, I did a 180, and it's just amazing and incredible. It also really changes your perspective on life and what's important and what's not, what's worth stressing about and what isn't, which is almost everything.
Yeah. Yeah. Well, having living with diabetes for 35 years and then not having to deal with it, I mean, it's just amazing to me. Well, I should ask you, how is it taking immunosuppressants so that your organs don't get rejected?
Yeah, it took a little practice to get used to that. It is, I mean, truly, even though I haven't taken insulin in 9 months, which is crazy to me.
Think how much money you save.
Well,
the cost of insulin.
But now I have like 30, immunosuppressant
I'm kidding.
drugs
I'm
to
totally
take.
kidding.
It's true. It's true, but the not having diabetes, not having to worry about it, not having to worry about what my blood sugar was, did I eat, if I have to go out, did I take backup with me in case my pump fails or my blood sugar is low or this or that, is like a freedom I have no memories of experiencing in my life since I was diagnosed pretty young. I would probably say I would take the immunosuppressants, even though there are certainly side effects and long-term issues with those as well, over being a diabetic 150,000 times. It took a little while. I was never great at taking pills. And when you first start, you're on a ton. I think I took maybe 30 pills in the morning and 10 at night. Now it's down to a slightly smaller regimen. You're just covering everything: antibiotics, antifungals, immunosuppressants, steroids, things like that. And they're constantly changing your dose and doing your labs. But I've gotten pretty good at it. I can take about 12 pills at a time, just throw them in and drink some water. Didn't start out that way, but it's just part of your routine now, just like taking care of your diabetes is.
Now, so there's a transplant team at UCSD here that works with your team in Phoenix, and so you don't have to fly out there all the time?
I do. So their protocol for the first year, I went back after 4 months after my surgery to Mayo. Then they have you come back for an 8-month appointment, which I recently did. And then they have you come back for a year, an annual appointment, which for me will be this August. So I get to go to Phoenix again in August, which is pretty hot. But then after that, they change it to a more annual schedule. So I think barring any issues, I'd go back in a year after that. And then a year after that, they basically follow you for about 3 or 4 years after your surgery. But they also work with, and you're managed more so by your local nephrologist too. And then, the transplant team at UCSD as well, like as needed. I know she'll work with them on things.
Wow. Now, before I give you a chance to end the program with maybe the questions of, would you do it again, and how has it changed your life? I want to tell the folks viewing and listening that, all of us here at TCOYD, we're dedicated to helping people live long and healthy lives. We have lots of content, including dealing with kidney disease, but all the other issues on all the social media channels. We have our website, our newsletter. Of course, our podcast now goes to over 200,000 folks around the world, and everything we do is free. So we want to make sure that all of you take advantage of the content we've put together for all of you living with diabetes. Now, Kristen, you went through a hell of a lot. I mean, 2 major surgeries within half a day. And I think the emotional changes, it's hard to imagine the ups and downs. Everything from being first told you need a kidney to the surgery failed. And look into the camera and tell our viewers and listeners, would you do it again? And what are the most significant impacts it has made on your life? Yeah.
I mean, first of all, I would do it, like I said before, 150,000 times out of 10. I would absolutely do it again, and I will, because these organs, most likely they're not going to last as long as I last. So I'll need new ones, and absolutely no doubts or second thoughts about doing this again. Even in the pancreas, some people, if it fails, they opt not to do another pancreas. But I absolutely would. It's been that life-changing for me to not have the 24/7 management of diabetes and everything that comes along with it, and that your complications, which Dr. E mentioned, I have, problems with my eyes and things like that. It stops the progression of things like that. The damage that's done is already there, but I know it's not going to get worse because of my fluctuating blood sugars, which I don't have 100% control over. None of us do. So absolutely would do again, would recommend for type 1s who are in that stage with their kidney disease. It's definitely worth learning about and exploring. And I think of all the things I've learned, most of all, I think number one is you have to be such an outspoken advocate for yourself and your care. A lot of people, just kind of accept what is told to them by medical professionals, physicians, and kind of follow that plan. And nobody knows you, your diabetes, your body better than you do. And it's important, I think, to really educate yourself on the disease itself, what your options are, what the facilities are, what the medications you're going to take are, and really push for what you want. It was a very difficult process to get, medical records and referrals and all the testing done and things like that. And sometimes you really have to be kind of pushy and outspoken, and not everyone feels comfortable with that, or their personality is like that. But it's so important to advocate yourself. And really, in my opinion, significant medical treatments like that should be a shared decision-making between the patient and their providers. Absolutely, because no one knows you better than you.
Kristen, well, thank you for that. And you have inspired me just to realize how hard it has been and how you took control of your diabetes. And being a self-advocate is important no matter what condition you have. Having a good attitude and even getting some help, mental health to deal with the mental frustration. So thank you for sharing your story. You're very inspirational, and I appreciate you coming to the show. And I'm so glad we had a chance to meet 2 years ago, and so thrilled that you're doing well.
Yeah, thank you so much. I really appreciate you having me here. It's also kind of a reignited passion of mine too, to be in and work in and volunteer and spend time in the diabetes space. And if anybody can benefit from the journey I've been through, I exist to help those people. It feels like a meaningful, worthwhile purpose to me.
Yeah, you have, and we will get blog questions. If I can't answer them, I'll send them over to you, and then you can answer them. So thanks so much.
Yeah, thank you.